Hi everyone. Today I will be talking about End-Stage Renal Disease Prospective Payment System final rule that CMS issued for calendar year 2022. Let's get right into it. On October 29, 2021, the Centers for Medicare and Medicaid Services, or CMS, issued a final rule that updates payment rates under the End-Stage Renal Disease or ESRD Prospective Payment System or PPS for renal dialysis services furnished to beneficiaries on or after January 1, 2022. This rule also finalizes updates to the acute kidney injury dialysis payment rate for renal dialysis services furnished by ESRD facilities. Additionally, the rule finalizes modifications to the ESRD treatment choices or ETC model policies to encourage certain healthcare providers to decrease disparities in rates of home dialysis and kidney transplants among ESRD patients with lower socioeconomic status. This makes the model one of the agency's first CMS Innovation Center models to directly address health equity. The changes to the ETC model, a mandatory payment model focused on encouraging greater use of home dialysis and kidney transplants, are expected to preserve or enhance the quality of care furnished to people with Medicare while reducing Medicare expenditures. In addition, this rule updates requirements for the ESRD Quality Incentive Program or QIP and includes public comments received in response to requests for information on topics that are relevant to the ESRD QIP. CMS will use the comments to inform future rulemaking and policy development. On the subsequent slides, I will be talking about these changes in details. Final updates to ESRD PPS for calendar year 2022. Under the ESRD PPS for calendar year 2022, Medicare expects to pay an estimated $8.8 billion to approximately 7,700 ESRD facilities for furnishing renal dialysis services. The final calendar year 2022 ESRD PPS base rate is $257.90, which is an increase of nearly $5 to the current base rate of $253.13. CMS projects that the updates for calendar year 2022 will increase the total payments to all ESRD facilities by 2.5% compared with calendar year 2021. For hospital-based ESRD facilities, CMS projects an increase in total payments of 3.3%, and for freestanding facilities, CMS projects an increase in total payments of 2.5%. Wage Index. The ESRD PPS uses the latest core-based statistical area or CBSA delineations and the latest available pre-reclassified hospital wage data collected under the Hospital Inpatient Prospective Payment System. The wage index is applied to the labor-related share of the payment rate to account for differing wage levels in areas in which ESRD facilities are located. For calendar year 2022, CMS is updating the wage index values based on the latest available data and using the Office of Management and Budget or OMB delineations as described in the September 14, 2018 OMB Bulletin number 1804. Update to the Outlier policy. CMS annually updates the Outlier policy using the most current data. CMS is updating the Outlier Services Fixed Dollar Loss or FDL amounts for calendar year 2022 using 2020 claims data as proposed. CMS's analysis suggested no substantial ESRD utilization change during the COVID-19 public health emergency or PHE, likely due to the patient's continued need for services. Therefore, the agency used calendar year 2020 data. Based on the use of the latest available data, the final fixed dollar loss or FDL amount for pediatric beneficiaries will decrease from $44.78 to $26.02, and the Medicare allowable payment or MAP amount will decrease from $30.88 to $27.15 as compared to calendar year 2021 values. Fluctuations, including the decreases in the FDL and MAP amount, are not uncommon due to the small population of pediatric beneficiaries. For adult beneficiaries, the FDL amount will decrease from $122.49 to $75.39, and the MAP amount will decrease from $50.92 to $42.75. Transitional add-on payment adjustment for new and innovative equipment and supplies or TPNIES applications. CMS is approving a TPNIES application for the first time for a home dialysis machine for calendar year 2022. The technology will receive the TPNIES for 2 calendar years. Final updates to the payment for renal dialysis services furnished to individuals with acute kidney injury or AKI. As required by Section 1834R of the Social Security Act, CMS is updating the acute kidney injury dialysis payment rate for calendar year 2022 to equal the calendar year 2022 ESRD PPS base rate and to apply the calendar year 2022 wage index. The final calendar year 2022 payment rate is $257.90 compared to $253.13 for calendar year 2021. Finalized changes to the ESRD Quality Incentive Program. The ESRD QIP is authorized by Section 1881H of the Act. Under the program, CMS assesses the total performance of each facility on measures specified for a payment year, applies an appropriate payment reduction to each facility that does not meet a minimum total performance score or TPS, and publicly reports the results. For scoring and payment adjustment purposes in the performance year or PY 2022 ESRD QIP, CMS determined that circumstances caused by the COVID-19 public health emergency have significantly affected the validity and reliability of the measures and resulting performance scores. The policies finalized in this rule are intended to ensure that these programs do not penalize facilities based on circumstances caused by the COVID-19 public health emergency that the measures were not designed to accommodate. In this final rule, CMS is finalizing its proposal to suppress the use of the following measures: Standardized Hospitalization Ratio or SHR clinical measure, Standardized Readmission Ratio or SRR clinical measure, In-Center Hemodialysis Consumer Assessment of Healthcare Providers and Systems or ICH CAPS clinical measure, and Long-Term Catheter Rate clinical measure. CMS is finalizing a proposal to adopt special scoring and payment policies for performance year 2022 to address technical issues with the ESRD Quality Reporting System or EQRS, and additionally due to the impact of the COVID-19 public health emergency on some of the performance year 2022 ESRD QIP measures. Under these finalized policies, no facility will receive a payment deduction for performance year 2022. CMS is finalizing a proposal to calculate the performance standards for performance year 2024 using calendar year 2019 data, which is the most recently available full calendar year of data we can use to calculate those standards. Request for information or RFIs. In this final rule, CMS also notes that it received public comment in response to RFIs that appeared in the proposed rule on topics relevant to the ESRD QIP. Commenters provided feedback on 2 COVID-19 vaccine measures that CMS is considering for inclusion in the ESRD QIP measure set in the next rulemaking cycle. Stakeholders also expressed support for and provided helpful insights on closing the health equity gap through future demographic data collection efforts and potential additional stratification of quality measure results by race, Medicare/Medicaid dual eligible status, disability status, LGBTQ+, and socioeconomic status. Finally, stakeholders gave feedback on CMS's plans to modernize its quality measurement enterprise by advancing to digital quality measurement for the ESRD QIP. Changes to the ESRD treatment choices model. CMS finalized changes to the ETC model, one of the agency's first CMS Innovation Center models to directly address health equity to further address health and socioeconomic disparities, which are a major contributor to chronic kidney disease and ESRD. The changes include incentives for participating ESRD facilities and managing clinicians to address health equity among their patients, including enabling access to alternatives to in-center dialysis, specifically home dialysis and transplantation for ESRD patients of lower socioeconomic status. While people from all backgrounds can be diagnosed with ESRD, the disease disproportionately affects low-income populations. Social determinants of health impact the quality of healthcare individuals are able to access to prevent and treat ESRD. Closing these health equity gaps through better access to care would improve healthcare outcomes related to this devastating disease and reduce costs. CMS finalized a two-tiered approach to address disparities in home dialysis and transplant rates through the ETC models, benchmarking, and scoring methodology. CMS added a health equity incentive to the improvement scoring methodology for both the home dialysis rate and the transplant rate. With the health equity incentive, ETC participants who demonstrate significant improvement in the home dialysis rate or transplant rate among their attributed beneficiaries who are dual eligible for Medicare and Medicaid or low-income subsidy or LIS recipients could earn additional improvement points. CMS will stratify achievement benchmarks by the proportion of beneficiaries who are dual eligible for Medicare and Medicaid or are LIS recipients to ensure that ETC participants who see a high volume of these patients are not disproportionately negatively affected under the achievement benchmark methodology. Taken together, these two changes acknowledge that socioeconomic disparities in access to alternative renal replacement modalities exist and may impact the ability of ETC participants to perform well in the ETC model while providing an incentive for all ETC participants to reduce such disparities among their Medicare patients. CMS also finalized additional modifications to the ETC model, including changes to the home dialysis rate and transplant rate, the achievement and improvement benchmarking and scoring methodology, and a process for sharing certain beneficiary attribution and performance data with ETC participants. CMS is also finalizing an additional programmatic waiver and other flexibilities regarding kidney disease patient education services under the ETC model. This is it for today. Thank you for joining me. If you like this video, please consider subscribing to my channel. Take care. Bye now.